Hi, everyone. My name is Caitlin Sylvester, and welcome to the 2022 Professional Education and Practice Implementation for Community Stakeholders Strategic Priority Team meeting for NCCRT. We want to use this time together to review the purpose and the work of this strategic priority team, and then lay the groundwork for what we want to do in the upcoming year. So again, I'm so happy all of you could join us today. We hope that this meeting and this community can really be a place where you can learn from each other, have the opportunity to ask questions, not only of our chairs, but also your peers who are also on this call, and ultimately help us really tackle the issues to help us achieve our goal of 80% every community. So before we dive in, I just want to do some quick housekeeping. I want to remind you all that this call is being recorded. We'd like this call to be as interactive and engaging as possible. So while right now I'm going to ask you to put yourselves on mute, we encourage you to unmute and come on camera if possible when asking a question or engaging with the group. We also have a chat feature on today's call, so if you can't come off of mute, we want you to be sure to add your comments, add your questions to the chat box while anyone is speaking. Yvonne Lopez and myself will be monitoring that chat. Yvonne, you can go to the next slide. So because we have a fairly small group, I think it might be nice to go around and introduce ourselves. So we would love to hear your name, where you're from, which organization you represent, and then maybe share a little bit about yourself. What is your favorite fall beverage as we're entering into chili season for many of us? Again, my name is Caitlin Sylvester. I'm located in New Orleans, Louisiana. I work for ACS and represent the NCCRT. And my favorite fall beverage, I think it's my all-year beverage. It's hot coffee. So I will then pass to Yvonne, and then we'll go to Nikki and then Katie.
Hi, good afternoon, everyone. It is so great to see all of you on this call today. My name is Yvonne Lopez. I am the program manager for NCCRT. I'm located in Manchester, Connecticut, and my favorite fall beverage would have to be hot apple cider.
Hey guys, you want to go ahead, Nikki, or should I? I'll hop in real quick. Okay. I'm Katie Beachy with the American Cancer Society. I co-chair this committee with Nikki, and I live in Lexington, Kentucky. So I would be remiss if I didn't have my favorite fall beverage be hot apple cider with just a little splash of bourbon in there.
I need to be in Kentucky. Hi, everyone. I'm Nikki Hayes from CDC. Happy to be here today. Along with Katie, I am one of the co-leads for this work group, and we're really happy that you're here today. My favorite drink, I'm like Caitlin, I love hot coffee any time of year. Right around about this time of year, Starbucks comes out with this, well, it'll be like in a couple of weeks, but this chestnut praline latte that is absolutely to die for. So that's my favorite drink, and I save up all year so I can splurge my calories on that drink. And I will punt to you, Sandy.
Good afternoon, everyone. I'm Sandy. I'm Noel. I'm actually in Florida. The organization I represent is the Florida Department of Health, Become Cancer. Fall beverage, coffee all year, because work full-time, school full-time, it keeps me going. And a happy second will be Celsius. I'm going to tag my colleagues also in Florida, Alexia Denton. Thank you.
Thank you, Sandy. Hi, everyone. I'm Alexia Denton. Like Sandy mentioned, I represent the Florida Department of Health, and I am the program manager for the colorectal cancer control program. And I would have to say my favorite fall beverage, I have this cinnamon apple spice tea in my office. I like to come in and drink it, especially today. It's a little cold being like 70 degrees, right, Sandy? So I enjoyed that this morning. So that's my favorite beverage.
Great.
Let's hear from, I'm sorry. Go ahead, Caitlin.
Oh, no, you go ahead, Nikki.
No, I see Beth Bruner.
Hi, everybody. Good afternoon. Beth Brunner with the Wisconsin Cancer Collaborative in Wisconsin. And I think a favorite fall beverage, I love hot chocolate. And we get pretty cold up here in Wisconsin. So our winters are like 6 months long. So, I mean, we go through a variety of hot beverages throughout the season, but I think hot chocolate's my favorite. Reminds me of Christmas.
Awesome. How about, let's see, Allison Antoine.
Thanks, Nikki. Hi, everyone. I'm Allison Antoine. I am also with the Wisconsin Cancer Collaborative. So Beth and I both are up here in Wisconsin. My favorite fall beverage is a new one, was new to me this year at Starbucks also. and it was an iced drink. So an iced chai latte with the pumpkin cold foam. If you haven't tried it yet, I would tell you to go and get it because it was life-changing. So again, you got to save up those calories, I think, for some of those fall drinks at Starbucks. But happy to be here, and I guess I will pass it to look at the list here. Elaine Russell.
Hi, can you hear me?
Yes.
I'm Elaine Russell. I'm from Kentucky, the Kentucky Cancer Consortium. And like Katie, I also like a splash of bourbon without the apple cider.
That's great.
Thank you, Elaine. How about Amy from Vermont?
Hi, I'm a strategic partnership manager with the American Cancer Society. I have the awesome opportunity of working on colorectal cancer work with a Vermont hospital, but I also get to do it through the work that I do in New Hampshire. And one of my community partners is on this call, so I'm kind of here to, we're headed to see you, Caitlin, and others that I've on next week for the roundtable. And so just popping in here, Hannah had forwarded me the invite, so here to just support and participate.
Awesome, glad you're here. How about Beth in Wisconsin?
I jumped in already, Nikki. So
Oh, I'm sorry, Beth.
No, don't worry about it. I'm welcome to say hi to everybody twice.
Let's try, let's see, Carrie in New Mexico.
Hello, my name is Carrie Virtue. I'm the Comprehensive Cancer Care Program Manager with the Department of Health. This is only my 9th week, so I'm excited to learn more about what you're doing with colorectal cancer. And I would say a mocha, a mixture of the coffee and the hot chocolate together is my favorite fall beverage. But I'm very curious now. I didn't realize Starbucks had so many different options. And also with the splash of bourbon, that sounds good as well.
Absolutely. Let's see, Catherine Young.
Hello, everyone. I am Catherine Young, coming from the great state of Mississippi. Program director for the Cancer program here at the Mississippi State Department of Health. And I think my fall beverage, I'll stick to hot herbal tea.
Thank you. Nice. How about Darcy Phillips? Darcy may not have speaker. Doesn't look like. Darcy, if you'd like to put your introduction in the chat, that would be great. We can move on to Debbie.
She already did. She says she's from Nevada Cancer Coalition.
Got you. Welcome, Darcy. How about Debbie Karkak?
Yeah, Kowchak. I know. Don't look at it and try to pronounce it.
Thank you, and my apologies.
No problem. Yes, I'm Debbie Kowchak. I'm from Nevada, Division of Public and Behavioral Health, and I am the Comprehensive Cancer Control Program Coordinator. And I would have to say my favorite fall beverage is good old-fashioned hot chocolate.
Nice, thank you. How about Gretchen?
Hi there, I'm Gretchen. I am working with the Maine CDC as the program coordinator for the colorectal cancer program. And I think I'm gonna have to go with Nikki on my favorite drink because I had that chestnut praline last year and it was really, really good. And they have a really good pistachio one too.
Yes,
I think that comes in the fall, yeah. Yeah,
they do. Thank you, thank you. And it's not too sweet either.
Oh, too sweet.
How about Jolene from Nebraska?
Hi, I'm Jolene Rohde from the Nebraska Comprehensive Cancer Control Program, the project director, and I like hot cocoa, and I recently discovered the coconut whip within the last couple of years, so that on top of it is probably my favorite one.
That's nice. Lisa May?
Hello, my name is Lisa Mai. I'm from Michigan. I represent the Michigan Colorectal Cancer Control Program. My favorite fall beverage is, I have to say I'm a little bit basic. I do like the Starbucks pumpkin spice lattes.
Nice. How about Lynn Robertson?
Hi, I'm Lynn Robertson. I'm actually from the UPMC Hillman Cancer Center, but I am a co-chair of the PA Department of Health, and I am the chair of the colorectal cancer work group for the state. I think my favorite fall beverage is hot chocolate with lots and lots and lots of whipped cream.
Thank you, and we're glad you're here. How about Sonia? Did we do you already, Sonia?
Nope, not yet. Can you hear me okay?
Yes.
Great. This is Sonia Younger. I'm from South Carolina, and I oversee the comprehensive cancer program here. My newest crave is mushroom coffee. So I'm going to drink it hot in the winter, in the fall, and I'm going to add a little bourbon to it. I think it's going to make it my favorite drink. So thank you.
Well, you have to tell us more about mushroom coffee. I'm going to have to try that.
It's really good for energy and focus. I love it.
Okay, nice, nice, nice. There's an iPad user, and I want to make sure that that we get you. So I want to just see if you are able to introduce yourself.
I think it was me. I changed my name.
Okay, got you.
I was able to finally figure out how. Hi, I'm Jenny Carter. I am from Missouri. I live in a rural area. I'm part of the Missouri Colorectal Cancer Roundtable. As well as I work for Exact Sciences on the medical affairs team. I'm a medical science liaison for them as well. And my favorite beverage, I wrote down mushroom coffee because it keeps popping up on my Instagram saying that I need to buy it, that and the mud coffee. So I'm going to try that. But I'm a hot chocolate person too, with lots of whipped cream. You can't go wrong with all that whipped cream on top.
Awesome. Thank you. Thank you. Caitlin, I'll put back to you.
Yeah, and thank you so much, Nikki. I think we captured everyone. Is there anyone that we're missing?
I can go real quick.
Yeah.
I'm Hannah Snyder. I am the coalition coordinator for Vermonters Taking Action Against Cancer. And I work with Amy Devitt on their colorectal cancer screening project. Oh, and my favorite beverage in the fall is probably a chai latte. If I'm feeling spicy, I'll throw in a shot of espresso and make it dirty. But yeah, good old chai.
Great. Thank you so much for joining us. And I have such coffee inspiration leading into the fall and the winter. So thank you guys.
So true, yeah.
We can go to the next slide. So you've already met them, but our wonderful co-chairs for the PEPI community stakeholder group are Nikki Hayes and Katie Bateji. So I'm going to pass to Katie to talk to you a little bit about the history of this group and the work that we've been doing in the past year.
Awesome. Thanks so much. So just to level set on what we're hoping that we can do during this call today, we want to let you guys know more about this priority team of the National Colorectal Cancer Roundtable and give you just sort of a 30,000-foot view of what the team has done to date. We want to talk about what our charge is, so what we're tasked with doing as a group, and then see if there are, with your feedback, thank you so much for joining us, because we want to have this open to your feedback so we can identify some themes for the strategic priority team moving forward and things that we might take back to the roundtable as a larger group and see implemented. So next slide, Yvonne. Thanks. Hopefully you're very familiar with 80% in Every Community, which is an initiative out of the National Colon Cancer Roundtable. And those of you that have been in this circle for a while will remember that 80% by 2018 was our original campaign through the roundtable. And 80% in Every Community is the evolution of that campaign into really reaching deep into communities that are still lagging behind in the screening rates. And what can we do to not just have 80% by 2018, even as like a goal number for a state, but look into communities that suffer disparately from this disease and make sure that it's 80% in that community specifically. So as a roundtable, the 4 areas that they're focusing on are listed here, and I wanted to let you know where we as a strategic priority team land within these things. So the focus areas are across the top. Those are focus areas of the 80% in every community strategic plan. And then peppered throughout it, you can see where different strategic priority teams of the roundtable focus their efforts. So we're the big blue there, the professional education and practice implementation, but focused on community stakeholders. There's another group with a similar name that focuses their efforts on providers and the professional clinical community, but we really take our lead from community stakeholders and what's needed in the community. So it makes sense that we would fall across those first 2 strategic priorities of trying to, first of all, assess what's happening in the communities that we want to reach, understand their context, and who the right messengers are, what are the barriers in those communities that we can help to address, and then try to overlap that or like cross touch points with mobilizing the efforts in public places. So how do we mobilize, how do we implement at touch points for community stakeholders that may be really effective, but haven't been maximized in the past? You can see, I won't go into each of the other teams, but if you squint, you can see where they focus. We've got family history, folks that focus on the health systems and providers, community health centers, social media, and then policy teams. So the hope is that each of these priority teams does some investigating as to what needs to happen, and then takes it back to the roundtable, proposes it as projects and implementation projects for the roundtable as a whole. And we'd really love to walk out of this time together as well with some things that this priority team can own moving forward. So if you can go to the next slide. So just to give you an idea, this team is actually kind of one of the younger teams on the National Colon Cancer Roundtable, but all of the teams are given a charge. So we promote dialogue around emerging topics. We look for project ideas, as I mentioned, that's related to our priority area. Hopefully some of you have been a part of what's called Blue Star Conversations. Those have been organized by NCCRT for the communities to come together and hear a brief overview of a topic from a subject matter expert, and then dialogue with one another of how they're addressing that topic in their communities. Then we also have folks that participate on advisory committees. So for instance, let's just say that this group said, we need to come together with a guide about working with food pantries. Well, then they would choose members to be on an advisory group for that project as it moved forward. And then we, of course, we have to be in dialogue with the other teams so that we're not overlapping what another team might be doing. And so, for instance, if we came up with a social media campaign that we wanted to implement, we would certainly need to coordinate that with the priority team of the roundtable that does public awareness, right? So we're always in dialogue with one another and really just looking for ways that we can promote 80% in every community across these groups. Next slide. So just again, I don't want to spend a whole lot of time on the past, but I think it's always important to know context. And so as we look back on what's been happening this year and what we want to do in 2023, some of the barriers that were identified, as you might imagine, is promoting any kind of screening during the pandemic was a challenge. And we also felt like there was an opportunity to work with CHWs. And there's been quite a bit of funding into public health for COVID-related projects with CHWs. And we thought perhaps we could capitalize on that momentum and work with CRC screening and CHWs, but we're still examining that opportunity. As far as what the group can do as we look forward to 2023, obviously we want you to hear from each other about what's working and what's not. We'd love to develop some training opportunities. If you tell us that there are needs that you're just not hearing from other groups, then the roundtable is certainly a group that has CDC partners and partners from NACDD and NACCHO and all kinds of national organizations that could come together and try to meet that need. And we also would love to find out what already exists for CHWs and specifically in regards to CRC screening specific information. and then to try to develop a strategy that we can connect just not from a top-down approach, but just to be informed about what's happening at the state level and coalitions and committees and roundtables that are addressing colon cancer screening. So the next slide, I believe, is where Nikki picks up, or is this me, Nikki?
This is me. So
Okay.
thank you. Thank you, Katie.
Yes.
And so now we are coming to the point where we want to really get your feedback and your insight on and on some of the places that we can go or where we might be able to go in this coming strategic year. I do want to share the roundtable's 3 priority areas for 2023. They are focused around mobilizing national and community level efforts that will lead to health equity in colorectal cancer screening. We also want to support on-time screening as soon as you're eligible, and we want to make sure that that screening is continued per screening recommendations. And we also have a priority area around promoting timely colonoscopy follow-up to positive non-colonoscopy test, and really making sure that folks are aware that it's a part of the screening continuum, and how do we make sure that we are positioned well in that spaces. So the next slide. So our team charge is to provide or to develop educational resources and implementation tools to help public-facing partners and stakeholders like employers, community organizations, your coalitions, member associations, and really take appropriate action to improve colorectal cancer screening rates and awareness. So we wanted to ask you to, in the context of our team charge and considering what the 3 priority areas are, we want feedback from you around have we been able to make progress to achieve the goals of the community, which is really developing these resources. And Caitlin has provided a link in the chat so that you can see what some of the resources are. But we want your feedback on those resources. And we also want your feedback on whether or not you think this is the right charge for the team at this time, and does it reflect what we think we might be able to accomplish together? Because of course, this is all of us working together. It's those of us at the national partner level, you know, really working to make these resources available and to really make sure that that you can use them. And then it's us working together to make sure that, well, the resources are exactly what you need and that they are helpful and that we're promoting them. So, and do we need to make any changes to the charge? So I want to start by let's asking the question, if we think this is the right charge for this group, and I want you to think about it. I do want to first say I am extremely excited about the diversity of the folks on the call today. So I really do appreciate not only that we have the health department program representatives on the call, but that we also have coalition members on the call too. And so I want your feedback, and if you can put it in the chat, or you can come off camera or not, but definitely unmute yourselves and just let us know, what are your thoughts about this charge for this team? Is it something that's accurate? And do you think it's something that we can achieve right now, and that it's something that would help you in your everyday work around trying to increase colorectal cancer screening? So what are your thoughts?
Hi, Nikki. This is Sonia in South Carolina. I love this proposal. I have partners at the coalition and with our University of South Carolina Colorectal Cancer Prevention Network, and they wanted to be a part of this meeting today, but they couldn't. So having this objective, this charge, I think would be something great that could help promote the great work that this coalition is doing, as well as U of SC. I think it's a great way to help, again, continue to put the information out there as far as the knowledge base to build those policy systems and environmental changes. So yeah, I think I still hold that knowledge is key in getting anything done, especially with our stakeholders. And lastly, I would say some of the partners that are approaching us now are saying that, yeah, basically what CDC says is golden for us. So yeah, if CDC, ACS, you guys are putting your brand on it, I think it's going to carry that much more weight if we would go forth with this initiative.
Thank you, Sonia. I appreciate your sharing that. And I do want to say, one of the things that we take very seriously is our own responsibilities as national partners is, is for us to help to collectively make these resources available for you so that at the program level, you're not having to spend or utilize very precious and few dollars to reinvent wheels or to create resources that, on the national partner level, we could do and have done. And we want to make sure that that's available for you. So thank you for that feedback. Any other thoughts about the charge? Is it the right time? Is it the right charge for this group at this time? And if it is, how do you think it might be helpful for you and the work that you're doing at the community level?
Well, this is go ahead.
This is Catherine from Mississippi. I definitely think this is the right time, appropriate time for this charge. My niece died of colorectal cancer when she was 29. So not only being personal and professional with me, but far too long have we isolated, things like colorectal and breast cancer where it has been stigmatized. And so being able to shed a light and shine this light on the fact that we need to aggressively work towards this so, families and people won't continue to die from a preventable disease is the right time for us to really push for this. And I really like the employers because we've been working on piloting an employer base where companies over 500, we did a survey and tried to gather information about what was the screening rates. Basically, are they family history? Do they know about things like this? And now to just implement some powerful things, interventions with those partnering organizations, I think is key. And looking at some of the resources on here, I love the fact that you have something that's geared towards employers and what can they do to step up the charge. Most of our workforce, of course, is people that are in the work. The only thing that, and I don't know what this falls under, is businesses. We found good success with our faith-based community, our businesses such as the barbershops and beauty salons, things like that maybe can be considered as part of the stakeholder, or it might even fall in the community organization category, but just being mindful that that those are areas where we can definitely capitalize on pushing out some of the education resources and implementation, because they are where most of our people visit, at least for African Americans. We have to get our hair done.
Thank you, Catherine. That's extremely helpful. Carrie, you were going to add some comments.
Yeah, well, first of all, I'm really excited to hear about the community health worker exploration. I feel like that's a really great resource, and I'm very curious about doing that work as well. And so the more that you develop that, I'm excited to hear more about that. And this is a great team charge. And I'm very new to all of this work, so I don't know if I'm speaking to it correctly, but one of our community partners, for instance, when we went to go visit them to support their education about screening rates and awareness, they asked very directly, do you have fit kits available for us? Do you know where we can get them? And so I don't know where to put that in here, but sort of more resources for the actual screening and availability of that. Maybe strengthening health systems is one way of thinking about saying it. It could be in the stakeholders, but so that requires actually having access to fit tests and then somebody who can do the testing, and then of course linking them to clinical services. But I do feel like that's an important piece of the charge as well, and just maybe speaking to it a little bit more strongly. And then health equity, I think, is also a really big topic right now. And so how do you include that in here? I think, and for us, at least in New Mexico with Comp Cancer, we are targeting the most, I don't know, the people who don't have access to healthcare. And they tend to, when you look at social determinants of health and you think of health equity, you know, those are populations that speak different languages. They don't have healthcare. You know, they live in more rural communities. So I'm just trying to think of like how to include that in the charge as well, the health equity piece and the lens to the most vulnerable. I don't know what the right word is, but.
Thank you, Carrie. I see Sandy, you have your hand raised.
Yes, and echoing Carrie, this is somewhat new to me. I'm a few months old in my role with Comp Cancer as program manager, but there's no, with the state of Florida, there's no one size fits all as it relates to communication. What works for South Florida works way differently for North and Central and North Florida. So the biggest thing that's screaming at me when I'm looking at like the charge is the culturally appropriate aspect of it, because what's culturally appropriate in South Florida is way different to what's culturally appropriate in Jacksonville, like North Florida. And even with Carrie emphasizing, like, even because when I referenced South Florida and North Florida, I hadn't even touched rural versus urban, because that's a whole different topic. But to even emphasize culturally appropriate, because the way you would communicate to one sect or group of a population on colorectal cancer, any type of interventions, is different from another group. So I think that's something that should be taken into account. Again, this is all new to me, but these are just a few points that I had that I wanted to just emphasize. Thank you.
Thank you for sharing that. So what I'm hearing is that that the charge is a good start and that there are opportunities that we have to you know, to revise and tweak it a bit, especially so that we can make sure that we are recognizing the fact that we need to be making sure that the resources are culturally appropriate, and that at this day and time it's necessary to specifically call out health equity, and also it would be really helpful if we included even faith-based organizations as examples in the charge itself, so that folks can see where they fit, you know, from an inclusion perspective in the work that we're trying to do. I also heard that there's quite a bit of cross-cutting opportunities for us relative to, you know, what medium we might use to share these resources. And so we'll have opportunities to connect with our public awareness and social media groups so that we can make sure that we're sharing this feedback with them as well. And then really looking at even some of the health systems or that group that's working on how do we catalyze healthcare systems so that we can address the access issues as well. So, you know, because we definitely hear it's one thing to get the message about what I need to do, but, you know, do I have a fit test? Can you give me a fit test? And can you tell me where to go, you know, to follow that up? And so we appreciate those comments. Lynn, you had your hand raised?
Thank you.
Yes, and I do, Lynn Robertson from Pittsburgh, PA, and I do agree with everything that has been said. I do have a comment though about some of the resources, because I love them and use them, but very often I will hear internally, you know, it would be great if our logo could be placed on it in addition to the logos that are on there from the CDC or ACS. So that may be something that maybe not for everything, but particularly going out to communities, because the communities know us and they do recognize the other organizations, but the trust generally is with us. So I think that's something to consider. And I totally agree in regards to the fit kits or whatever. I happen to be very blessed because I have a group that supports me philanthropically to provide fit kits, and also the processing of the fit kits so that I can hand them out at the time when we're educating within the community. And I also agree in regards to the need, not just for the literature you have, But I think in regards to fit kit literature, now it took me a long time to find this out, and I still don't have the fit kit instructions in every language I need, but I'm working on that on the side to get them translated on my own. But there are about 20 languages that the fit kit instructions are available in, but that's not general knowledge. And some of the people that are involved with the fit kits aren't even aware of that. So you have to get the right resource. But I think the only way we can continue to have diversity and inclusion is that we make sure we have the literature, but also the information in regards to the kits or whatever we're distributing or encouraging in the native languages of the individuals.
Great points. Thank you. Elaine also mentions in the chat that it would be helpful to have continued education on how to engage the community in planning, implementing, and evaluating the work that we're doing. And so I think that that's also another great point. And we might be able to look again at some of the other strategic work groups to see how we can share these opportunities for some very nice cross-cutting collaborations, but really appreciate the point and making sure that we're bringing that thought to the surface, because we really do need to make sure that that we all know how important and how critical community engagement is to the work that we are trying to do, and then even to recognize that we can use that help on the ground in our planning is absolutely something that we can look at. Can we go to the next slide? Because you all have given us some incredible information. One of the things, so what we want to talk about is, even in this dialogue that we've had so far, what are some of the common themes that emerge? We've talked about community health workers, and we started early on in the dialogue talking about employers and work sites, and really expanding that so that we have can also maybe include some of the community organizations, businesses, the faith-based businesses, the faith-based organizations in this conversation, patient navigation, and then how do we work with state-based groups? Are there other, what else are we seeing that we really might want to use in our planning for what we try to focus on in the coming year? Are there any other things? I've heard health equity. So any other thoughts?
Nikki, one question I had, and now that I'm seeing it on the slide, is anyone working with state level roundtables or state level colorectal focused work groups or coalitions? And is there anything that this group can provide to support those sorts of organizations or collective groups?
So I see, I know we do have a couple of chairs on the call. So that would be helpful. And then I also see that Lynn has her hand raised.
Yeah, I was just going to say, in Pennsylvania, I do chair that group across the state, and we all do work together. And we even have some physicians on the work group that are really willing, and really do work with us to engage
look at
all our areas. So I think that is really important.
Mm-hmm.
And I guess one theme that I think needs to be stressed a little bit more is the younger age in colorectal cancer. We heard somebody on here who lost someone quite young, and I think the information's out there, but I think it's not really stressed as much as it could be. And most importantly is what I find very often is the younger people that may be having symptoms that need to be looked into don't always realize that it may take a lot to be your own advocate and really get the necessary testing you need, because it still seems, at least in our communities, that it's not taken seriously.
I'm
Thank
sorry.
you.
I'm sorry. I don't know if anybody else has their hand raised. This is Debbie Kowchek from Nevada.
I was just going to call on you, Debbie.
I'm obviously technically challenged because I cannot find my hand raise signal. So forgive me for interrupting. I just wanted to share that back in 2020, our colorectal cancer program was defunded. So it was terminated. And as a result of that, we started a colorectal cancer work group statewide, which has been a really positive experience. And I wanted to mention too on the previous slide that the resources would be so helpful for a group like this, where at a community level. And I liked how you talked about employers, because we're you know, starting to work with small businesses and reaching them. So yeah, it's been a really positive experience, and this just seems like it would add to our resources.
Great, thank you for sharing. Any other thoughts around themes and or the charge? So can we go to the next slide? So one of the things that we hope to do, as you all know, we will be meeting in person. Haha, yay, thank you for the opportunity to get together in person again. But we will be meeting in person next week in Baltimore. I hope that some of you will be able to be there. And for those of you who won't be able to be there, I really do want to re-emphasize again how much we appreciate your being here with us today to share your insight and your thoughts on what we could be doing, what our work group activities might look like moving forward. And I wanted to just kind of talk about, you know, where we're going to go from here. We'll have a bit more of a dialogue. We'll take this information as we promised in our invitation into that meeting, and then we'll start to think about how we might make recommendations for what this work group might want to focus on or should be focusing on the coming year. I do want to say that just to kind of give you some kind of level setting for what that might look like and the principles that we kind of use behind it. And when we're making these decisions, one, we do want to make sure that the activities are collaborative. So we want to be able to, just as we've had the opportunity to engage you all on this call today, we want to make sure that we are engaging the members, multiple members from the organizations within the roundtable and our various partnerships. And we want to make sure that whatever we're doing, the activities that we're doing, that they are absolutely responsive, one, to the mission of the roundtable, that they are responsive to what our priority focus is for the work group, and that they are responsive to the 80% in every community strategic plan, which is why it's been really, really great to have you all weigh in, one, on the priorities for the coming year, and then to make sure that our charge is really centered in the right space and place. We want to make sure that the activities are impactful so that we can will likely have a measurable impact on screening rates in your communities. We want to make sure that whatever the work is that we plan to do, that it's feasible, that it's something that we can get done within a year to a year and a half, and that it's something that we can do within the limits of the NCCRT staffing capacity, and that the projects typically range from $25,000 to $50,000 a year, but thankfully some of the things that need to get done, we can get done with little or no funding. We want to absolutely make sure that the activities are equitable. So we are looking to make sure that we are addressing the barriers to screening in underserved communities, and that is something that's not already being done. We don't want to be duplicative, to duplicate efforts or to replicate something that's already being done, but we want to really make sure that we are contributing in a way with new activities, and that the members can support it. You know, we want to make sure that the NCCRT members have an opportunity to contribute to it, whether that's time, funding, or their own expertise, but that it's something that they can support, and that it's something that's sustainable, so that after we have finished the work on this particular activity, not only has it made an impact on screening rates, but it's something that that we can all take up as a part of the ongoing work that we're doing. So we will be looking over the next few weeks, especially after we have this conversation next week with other members who might come to this work group meeting. We'll take your feedback and absolutely use it to plan and inform where we're going forward. With that being said, then I'm going to kick back to you, Caitlin, if you don't mind, because I think that's my last slide, right? Fine. Yes.
Yes,
so
I believe so. Thank you
Thank you so much, Nikki, and thank you. I was jotting down notes frantically. This is a really wonderful conversation. I really appreciate you guys giving us your thoughts and your feedback. So I posted some information in the chat on the annual meeting. If you're unable to attend us, I do want to let you all know that we will be recording our main panel sessions. We'll have those posted on the website, and we can be sure to share that information with everyone who joined this call today. If you are attending, because we won't have an in-person meeting, I recommend you attend one of the other 5 strategic priority team meetings. Pick up some ideas, share your feedback and what was discussed on this call, and then we would really love to bring these ideas back to our next PEPI community group that we'll be hosting in 2023. And so, Yvonne, you can go to the next slide. So with that, thank you guys so much. I'd love to open it up if there's any last comments or feedback, or if you have any questions about NCCRT or the annual meeting. But again, thank you all so much. And thank you to our wonderful chairs for hosting this important session for us.
Thank you for hosting this meeting. I did want to just mention one more thing because I think it's in development and might already be implemented in Louisiana with community health workers, but they're looking into getting reimbursement for talking about screening and promoting screening for community health workers, so that Medicaid would actually pay the community health workers for their time for doing that. And I think that's a really interesting and valuable, I guess, policy approach to how to implement this work and to promote screening more. So if it might be something to look at also in more depth. We are doing that in New Mexico. We're trying to figure out how to get the community health workers reimbursed through Medicaid for talking about screenings of all kinds, but anyway, it's just something to think about. And I'm hoping I'm going to see some of you next week. I put in a request which still hasn't been approved, but maybe I will see you next week in Baltimore. I look forward to it. Thank you.
That would be great.
We'll keep our fingers crossed. And I do want to say thank you, Carrie, for mentioning the fact that, we are several folks at all different levels are looking at ways and really advocating for the ability to reimburse for community health workers services and in whatever way fashion, understanding all of the challenges that we may have, when we kind of figure that out, but that it's absolutely a necessity. And so I appreciate your sharing that thought. And what would really be helpful for us is, as you all are doing this work to really promote and advocate for that, and even piloting ways that it can happen at the state and local level, if you can please be sure to share, like those best practices and those examples with us, so that, as a collective, we can all be talking about these proof of concept approaches that really do work. And Catherine, I see that you're saying that it's working well. That you all are working on that in Mississippi as well. And I think that, the more we share, either with your program consultants, with your ACS, your regional connections, it would be really helpful for us to be able to share these stories with others as we're having our conversations, at every level and every place and space. And Allison has in the chat that she wants to add that any kind of CRC screening promotion should definitely emphasize the role for the follow-up of the colonoscopy after an abnormal fit stool test. And so, yes, that's work that we will be really focusing on and as a priority in the coming year. And so hopefully we will be able to have resources that are available that will support you all in that those conversations that you're having locally. We were in a meeting just last week, and someone mentioned that even though the colonoscopy as a follow-up to an abnormal fit is now considered a part of the screening continuum and is not charged, some people still don't know that, and some people are still having difficulty with that. So the more that we can do to really make sure that we're having the conversations and we're having them appropriately is important. So yeah, and because that's a backbreaker if people don't understand. So again, we appreciate everything. Again, cannot thank you enough for taking the time out of your afternoon today to join us. But the feedback that you've shared has been invaluable. And so we really are looking forward to kind of processing and analyzing all that we've come out of this meeting today so that we can plan how we move forward. And we certainly do hope that when we reconvene that you are able to join us again, and that you will continue to work with us in this group and help to provide insight and feedback into the work that we're doing on this strategy group. So with that being said, Caitlin, I'll send to you to close out.
Yeah, thank you all so much. We will be posting these slides and a link to this recording on our website, so we'll send that out to you once we're able to get it on our website. Please feel free to reach out to me if you have any questions or additional thoughts or information. And then, like we mentioned earlier, we'll be looking to set something up in the new year. So thank you all so much and have a great rest of your day.
Thanks, everyone.
Thank you.
Thank you.
Bye.